Hey guys, welcome back to the Skinny Truth Podcast. We are on episode 2 and we have another special guest today. But first, I do want to say thank you guys again for tuning in. Everybody was so excited that we're back. And we hope to be doing these regularly again, just getting back into the swing of things. But as always, thank you for liking, commenting, subscribing. We're on Apple Podcasts, Spotify, and you can watch us on YouTube. So with that, I will let Dr. Roller take over and he can introduce our guest.
All right. So last week we focused on obesity and its impacts on women. Mm-hmm. And so this week we're going to talk about obesity and how it impacts men. And it's a completely different perspective. And so probably no better person to interview, because we had Dr. Kristen on, my wife, last week. So right. No better person than Luke, your husband,
yes,
who also went through it, to get the perspective of not only just men in obesity and men in surgery, but also even couples being married and right. going through it. So
for sure.
Anyway, I'd like to introduce Luke. He's also one of my patients from, it's been at least, when was your surgery, Luke?
He's coming up on a year.
October 11th, right?
Yeah, he would. Yeah, right around there. So almost a year.
Almost a year.
Yeah, I mean, number one, you look fabulous. But I remember all of the stuff around your surgery, and when Laura introduced it on social media, and we'll touch on that too. But so, Laura, you're about 3 years out, right?
Yep.
And so you're around 400 pounds, BMI around 70 when you decided to have surgery. Luke, and you were always kind of BMI around that 35, 36, needed to lose, 70 pounds or so, but diabetes, high blood pressure, that kind of stuff. So what took you so long to come around to think that you needed surgery?
Well, when she had it, you're like, okay, I think I can just, she's doing it. She's eating better. She's doing healthy. I can just do anything and do what she's doing, and I'll lose the weight and get in shape. And she's going to the gym, I'm going with her. And it's like, okay, I'll just do that. That's what you're supposed to do. Diet, exercise, get in shape. And then you kind of just do that for a while and nothing happens. Like I probably lost in the almost 2 years. We worked out together. We ate good together. I think I lost like 3 pounds. And, you feel a little better going to the gym and you're doing all that, but literally you get going, and then I still have diabetes. I'm still taking my blood pressure medicine. Every time I go to the doctor, something else came up. I tried all the injectables, they made me sick as can be. And then it's like, what else do I do?
And truthfully, he did. He ate what I ate.
Yeah.
He went to the gym with me. I mean, he was doing everything that I was doing. I was losing weight and he was not.
So I see this. I mean, this is all the time when, and it typically goes like that. The woman comes in for pre-op. We're talking with him, and I'm looking at a husband who I know I can clearly help.
Mm-hmm.
And I always say, have you thought about this? Because I really do like it when couples do it together. And that is one of the most common misconceptions that I hear is, well, I'm just going to eat like she eats and it'll happen the same. And my answer to that is, but you don't have the tool.
Mm-hmm.
Yeah.
And it's like, I'm going to build a house just like that guy over there, but I don't have his tools.
Right.
So how could I possibly expect to achieve the same outcome? And it leads to lots of frustration. I can't even imagine how frustrated you must have been during that time.
Yeah, I mean, and you're happy for them, but then they're losing, they're getting in shape, and then you're trying and you're not doing the same things, and it's like, okay, why?
And I remember,
why can't I be the same?
And I would say I brought it up to you. I mean, it was fairly quickly after my surgery. I was just like, hey, have you ever thought about this? The big thing for me was his diabetes. I mean, diabetes is just so bad. I mean, long term, the effects that it has on every part of your body. And I was in cardiology, and I saw firsthand those patients coming in with all kinds of issues.
I bet you did. It's the
blood
sixth
flow
leading cause
issues to
of
the heart, to the legs. I mean, just terrible.
It's the sixth leading cause of death in the country, but it causes heart disease, strokes, heart failure, leading cause of amputations, dialysis, kidney failure, blindness, sexual dysfunction. Like, there's the list of bad things about diabetes. So that's something else to get into, right?
And I think it's hard though when people, like, you know, he's 40 years old, he doesn't have any of these issues. You just think, I'll take medicine for my diabetes and it's good. Well, no, once you get to 80, I mean, or older, you know, that's when the things start creeping up. And it's bad news. And so that's why I was like, hey, have you ever thought about this? You know, like, it can be reversed in a lot of patients and you wouldn't have to take medicine. He's like, nope, I'm not doing that. And I did not push it.
Why? So why were you so resistant to the idea of surgery? Even after Laura had it?
I don't know. You think you can do everything yourself. You know, I'll do it this way and I can do it. And I don't need all that help. I can do it. You see other people do it and you're like, okay, they're diet and exercise. I can do it that way. But it doesn't always work for those people that way.
But you were nervous about, like, he saw what I wasn't able to eat in the beginning and the things I had to give up, and you were hesitant because of that too, right?
Yeah, you have to change. You have to want to change too. You have to change what you're eating, when you're eating. Can't drink, like, I drink Diet Mountain Dew like 10 times a day. You got to give those up. You know, you have to be ready to change, and it takes seeing someone. You know, it took me seeing someone to make successful, and then be like, okay, she's making this change for herself. I'm trying to make the change, but I'm not doing the same things. It's not getting the same results.
It's really hard on the front end, I think, because all you see is what you're giving up.
Yeah.
And it's hard to know what you're going to gain.
Right.
And that's the leap of faith with surgery. You know, because you see other people and what they're gaining, but it's hard to know for yourself. Well, it worked for them, but maybe not for me. Nothing else has worked for me. Why was this going to work? And I mean, so that's 2 years of frustration you went through. And then you even mentioned that you tried the medicines. And I do remember you had some pancreas issues amongst getting sick. So I guess you had to stop those.
Yeah, he was on Mounjaro. And you took it for about 6 months, and he did lose weight. I mean, you lost like 30 pounds
30,
maybe
pounds.
with that. But every time he took it, like, he was sicker than a dog. Like, it really affected him like that. And then it just progressively kept getting worse. And one day he was in so much pain. And this is not someone that will ever go to the ER. And he's like, something's not right. I have to go. And they did a CT and they found a pancreatic cyst, which scared the bejeebies out of me because pancreas stuff is just terrible.
Yep.
And anyways, they said you cannot take those for the rest of your life. No GLP-1s. And so then it's like, okay, well, now what do I do? And he gained, and I'm going to tell you, he gained all of that weight back. I mean, I want to say, it was quick. Like,
when you stop those medicines, all of the weight will come back.
Yeah.
There is no, and because you lose about 25% of your muscle mass, 20% of the weight that you've lost is muscle, you've now put all the weight back on, but in the form of fat. So you're even more obese than before. Okay. So then you're sitting there at a BMI of 35 but all the medical problems. And so you can't do the medicines, the dieting, the exercising, the following what Laura does isn't working. So how did what was the moment where you go, I need to do surgery?
Well, it's kind of like, I see all her success and I'm like, okay, if I want to be around the playing catch with my kids and running out in the backyard and coaching basketball, like, you just can't do this stuff. And I'm like, okay, it's time that I do something for the longevity. She did something for our family. She's making sure she's going to be around. I need to do the same thing. I need to make sure I'm here for my kids when they grow up. I need to make sure I'm here for grandkids when they grow up. And not just here where I can do stuff with them still. Living. Like, I'm not just here. I am being able to get out and play and get out and do the things with them. When he says, hey, let's go play catch, I'm not just playing catch, but I can squat down and catch for him. I can run longer than a minute to try to, chase him around the front yard. And when you got 4 kids and little ones that want to play all the time. You got to have more energy. And so it's like, I have to do something. It's okay. I can't, my pride's got to be set to the side. You know, I can't say I'm just going to be a man. I'm going to do it myself. Sometimes you just have to say, I need help. And
very
I can't do it myself.
Classic for men. We usually have a hard time seeking help, especially medical help for whatever reason. And that's me too. I mean, you know, I've done that multiple times, and even as a doctor, it's hard to ask for help. So I completely understand.
I do want to say too, though, another thing that would come up. So our insurance is one of the insurances that bariatric surgery was an exclusion on our plan. And when I said that I wanted to have surgery, and the cost of it, I mean, it's a hefty cost. He, without a doubt, was like, okay, if that's what you want to do, like, that's what we'll do. Like, we'll make it work. And then with him, he's like, I'm not spending that much money on myself. Like, I'm not doing this. And it's just like one of those things, like, sometimes people just pour into other people, but then they put themselves aside. And I don't know, because that was one of your holdbacks too, was like, I don't want to spend all this money on me for this. And
I'll never forget you texting me saying Luke wants to do the surgery. And I'm
like, right. You're like, what? Yeah.
He finally came around.
But you came around. Isn't it the picture of the guy that's getting ready to do the bodybuilding?
No,
isn't that the picture?
It's one of your patients. I'll have to look up his name. Posted like a before and after, and I saw it on her phone, and he had this similar body type thing, and it was like, and I was like, you know, that could be, you know, he did it, and it looks a lot, you know, he's getting healthy and looked better, and I was like, you know, I could probably do that.
And then you came to me and you're like, did you see that guy's picture on Roller's page? Do you think that would work for me? I'm like, well, yeah. And then that's kind of when the wheels started turning.
It is. So that's why we try to post on our pages our patients, you know, the before and afters. It's of a variety of different types of people, ages, male, female, black, white, old, young, like really big, not that big. And one of the keys to Luke's problems was where he kept his weight. And this is how obesity in men is oftentimes different than obesity in women. Men have what we call more visceral fat. It's in the middle. And that's a much more dangerous type of fat because it's where women tend to keep it, you know, hips, butt, legs, you know, peripheral, not necessarily on the inside.
Around their organs.
That's right. Higher risk of fatty liver disease, heart disease, diabetes. And it's a worse kind of fat because it has a higher death rate. And so when I look at you two, I've got you at a BMI of 70 and 400 pounds without really any medical issues, but peripheral obesity. And Luke with only 70 pounds to lose, BMI of 35, but all of the medical problems. And it's how he kept it. It was his distribution because his was all in the middle.
Right.
And so let's talk a little bit about, Luke, how you felt when everybody kept, because I remember Laura posted and, hey, Luke's having surgery. And there was all of these comments about, what? He doesn't need surgery. He's not that big.
Yeah. Yeah. That's the number one thing that people say.
Yeah. I mean, how did you feel, or how did you, what did that impact did that have? Everybody saying you're not that big.
Well, I mean, yeah, they say not you're that big, but they don't have to go to the doctor every time you go to the doctor and some other medical issue comes up. You know, sometimes you're not doing it. I wasn't doing it just for the weight loss. I was doing it for the health. So it's like, yeah, you can see someone on the outside, but you never know what's going on inside. Like you can't walk around with a sign that says, hey, I have diabetes. Hey, I have blood pressure. Hey, I have all these other issues that they can't see. So it's like, you're only seeing a small piece of the puzzle. You're seeing just what's, you know, right there on the outside. And so you just kind of have to take it. Okay, you don't have all of the things. Okay, yeah, I'm not that big, but I'm not that healthy. So
man, that is so spot on. They don't know your chart. They don't know your medical problems.
You can't carry it around and tell them other than the weight that's on the outside. They see that and
that's
they're
right.
like, okay, well, he's okay.
It's not that much.
Yeah.
you don't have to weigh 400 pounds to suffer the consequences of obesity. You just don't. And I've got people that are, in those lower BMIs, 32, 33, that insurance will never cover, but they're diabetic, have high blood pressure, their knees hurt.
Yeah.
They can't move around. And so
what I remember when you came out, I think I've talked about this before, but after you came out of his surgery, you had another patient that you were doing maybe before or after, I don't remember, but that patient's BMI was like in the upper 40s. And you were like, on paper, you would think that she was more unhealthy if you didn't know the other diagnoses around it than he was. But when you got in there to look, like he was way worse off than she was with the fat around the organs and stuff.
No, it's absolutely true. I mean, it's where you keep the fat. And when you look at Luke's chart, if you're just looking at his medical problems, you'd go, this guy must weigh, close to 350, 400 pounds. No, he didn't. So you have the surgery. And here's the other difference between men and women in surgery. Laura, took you about a year and a half, closer?
I would say a year and a half, to get, and then I dropped a few pounds, like between that year and a half to 2 years, but a year and a half to get the majority of it off,
Okay, and then Luke, how long did it take you?
It was about 4 months, 3 months,
4 to 5. 4 to 6. I don't know.
That men lose weight so much faster than women. And so this is something else that we have to talk about when you're working with men and women and couples is it's like, okay, the man is going to lose weight like straight up and then level off. Women will go like this. You're going to end at the same spot. You guys have ended completely the same spot. It took him 4 to 6 months and it took you a year and a half.
Right.
But you're both, at literally lost the weight, healthy, all the stuff. And it's really hard. So I always like women to go first and then make them promise not to kill their husbands when they lose as much weight in 6 weeks as they did in 6 months.
Right, exactly.
Like I did all that work and look at him. He's now the same. He's now the same size.
Yeah, and it does take a little bit because I lost it and then I was leveling off. I leveled off a lot, and then you go up, you hit the stalls and stuff, and they seem like they take forever. But then you get down and you're like, okay, now I'm at the same weight I've probably been at the same weight now for.
You've maintained 6 months.
Yeah. I mean, since that time, and then you're like, okay, well, it took her a long time. Now I'm at the same weight. Should I keep going? What am I doing? Am I doing something wrong? Should I still be losing? Or then so you're like, so it does. Even though you get off faster, you still have to be like, okay.
You're just at maintenance a lot earlier.
Yeah,
the decision making is still there. It's just you're not trying to actively lose.
Yeah.
So all the medical problems are gone?
Yeah.
Correct?
Yep. All the medicals. You go take off. Like I didn't go back on my diabetes medicine. Minute after surgery, never went back on it. And my last A1C was like,
oh gosh, it was like 4 point something.
Yeah, like 4.2.
That's awesome.
Yeah.
And I think my A1C going in was 7, 6, 7, or
7,
almost 7. Like my highest was like almost 8. So.
Yeah, so you went from a slightly uncontrolled diabetic to no diabetes at all.
Yeah. And you're not on no medications. He was on high cholesterol, high blood pressure.
Yeah. So I kept on the blood pressure for a while, and then I started getting, where you get dizzy because you're taking your blood pressure gets down. Like,
because you had low blood pressure.
Yeah. So I got off all those, and then I went back and had my scan for my cyst.
Oh, yeah.
And that was gone.
The pancreatic cyst is gone. He had that.
Yeah.
Fatty liver's gone. So.
And fatty liver, so that's going to be one of the number one causes for a liver transplant soon. I mean, it leads to cirrhosis. And, why, this is a discussion we have with the medical community a lot, especially doctors. Why is controlling diabetes just as good as not having it? And in my opinion, it's not. It's not just as good. No patient wants to have diabetes and have it controlled.
No.
Especially when you have the option of getting rid of it.
Yeah, for sure.
So now that you've lost the weight and are healthier, this just gets into a little bit different in how men Did you ever get checked for low testosterone before surgery?
No.
No, you never did any of that stuff. So that's something that we see a lot of men coming in with, the diagnosis of low T. And said, listen, you're going to probably get to stop all that. You don't have low testosterone. It's the obesity that's causing it. And it's what a lot of men don't realize is fat cells turn your testosterone into estrogen. So a couple things with men and low testosterone is like, why is low testosterone bad? It leads to cardiovascular disease and hardening of your arteries, and it leads to metabolic syndrome, which can increase heart attacks, and depression, poor blood sugar control, erectile dysfunction, as well as infertility. And so they actually studied this out of the Cleveland Clinic. And what I thought was interesting was that after bariatric surgery, men who had bariatric surgery had an 85% increase in their total testosterone.
Wow.
Where the group that was getting medical therapy for their low T only showed a 10% increase.
Oh my gosh. Wow.
And that was out to 5 years.
That's huge.
And so it's not uncommon for men to come in, and that will be a complaint is their sexual libido, and they're on Viagra, and they're on these different things that that are very specific to men,
right?
Because of their testosterone and how obese. And that's probably those are a little bit harder areas to talk about as a man. Going to a doctor and saying this is some of my issues.
For sure, yeah.
But, there's a lot of issues surrounding that. And so, you may not have been tested, but how do you feel, Luke, now, like in all areas compared to before surgery?
It's night and day. I have more energy, more drive to do stuff, around the house, out with kids, anything. Just you feel better. And so you do more stuff when you feel better. You don't just want to sit around and do nothing and help, when you can and when you feel like it. You're getting up and doing what you need to do. I feel great. Like I feel like I can do anything I want to do. That, you don't feel that before. You can say, we can play for a little while in the backyard. But now I can say, okay, let's just go. We can do whatever we want to do.
Yeah. And that's got to be pretty freeing, to not be limited by your weight, because you guys travel now, you drive all the time, and that's really hard to do.
Oh yeah.
Yeah.
Sitting the whole time.
You pretty much didn't travel.
No.
Yeah.
Or when you did, you had to, make sure I get these exact seats on the plane.
Yeah.
Or these, we're going to go this area because, it's not doing as much. You really have to plan your trips and your travel around, yourself and your limitations. And now you can just say, those people are doing that. I'm going to go do whatever I need to do, and I'm going to go over there and do it. So.
Yeah, no. And so then you fast forward, and I remember probably one of Laura's, I don't know, your 4 or 6 month post-op post. And that's when everybody saw the side-by-side where you went from not that big to, oh my gosh, you look so good.
I get a lot, like, I didn't think you had that much, but now when you see a picture, you're like, oh yeah, you did.
Even my mom says that.
Yeah.
She's like, I never realized how heavy Luke was until he wasn't. And even me, we look at pictures and I'm like, man, I even personally did not think that Luke was that big. I still thought he should have surgery, but I never thought he was that big. And then you see the after, you're like, wow,
yeah, I mean, there's a lot of guys that say, well, I'm just a big guy, big boned, and you're not big boned. There's no such thing as big bones.
Right.
We can X-ray your bones and see that they're the same as
everyone else.
Everyone else's. It's just, I think, become more socially acceptable for men to carry it in their belly and it be just the way we're supposed to look versus, tall drink of water like he is now, like Michael Phelps, or Tiger Woods. It's a different mindset. Look, we're supposed to.
And I do think it's more socially acceptable for men to be heavier than women. Do you feel like you were treated differently? You don't feel like you're treated any differently now than when you were heavy, do you?
No.
And I do.
But people don't say stuff to guys either. They're not going to say, oh, you're big.
Well, nobody ever said anything to me, but it was like holding a door open or just the way people look at you and treat you. now as a woman is so different than it was before.
But I'm also a guy, so it's probably oblivious to it.
Well, that's true too. You never know what's going on.
Oh,
hey, you
yes.
said it.
It is true. Hey, it's true.
Listen, ignorance is bliss. And
Right,
we're just blissful. That's all.
Yeah,
That's all you
that's
can
right.
say. You know, it's things that you haven't run into yet, but you can be thankful for. It comes to specifically men and obesity is you've significantly decreased your chances of prostate cancer by losing the weight. And some other interesting stats are that if you're just overweight, so in that BMI of 25 to 30, your chances of prostate cancer go up by 8%.
Wow.
If you're obese, it goes up by 20%.
Ooh.
And if you're severely obese, your chances of prostate cancer go up by 34%.
Wow.
It's one of the number one risk factors for prostate cancer. And the problem with prostate cancer is where it's located.
Mm-hmm.
And it's down there in your pelvis, your prostate is, where there's all sorts of just really essential things we need to function as a man.
Right.
And so it's not only just like, does your risk of cancer go up, but if, you have cancer, there's an increased chance that it's spread beyond the prostate with obesity, which makes treatment harder. And if you have to have surgery, your chances of developing urinary incontinence after that also goes way up. So obesity makes normal things much harder to deal with. Right. And so that's what we look at is, prostate cancer, its psychological impacts. You look at infertility is a huge thing with men, but the women get checked out first.
Right. You don't think of the men.
You don't think of the men. And, there's some really good studies out there that like, if something like up to a third of men, like when they're looking at it, with obesity, won't have actual sperm being produced.
Oh, wow.
And, it's one of the bigger causes of infertility for men. It's really
obesity.
One of the biggest one is obesity. And again, all comes back to the low testosterone for the most part. And so it's this vicious cycle. If you have a 42-inch waist versus a 32-inch waist, your risk of developing erectile dysfunction is twice as high.
Wow.
And 42 is not necessarily that big, but it's about, again, where it's carried. It's carried. So there's just all sorts of things that impact I think women are at higher risk for a lot more cancers. Ours are more specific on what obesity causes, but men with obesity also have a higher chance of dying. It's
and
much
isn't
more
that
dangerous.
Like belly fat? That's the sudden cardiac death, isn't it?
Yep.
Yeah.
It's belly fat, fatty liver, diabetes, high blood pressure, all go together. It's this really bad, concoction of diseases that go together that cause you to die.
Right.
That losing your visceral fat gets rid of it all. So Luke has literally decreased his chances of dying from his current problems. It was diabetes, high blood pressure, high cholesterol. Now preventing all sorts of problems down the road. And that's the thing. You don't even know what you have gained because you'll never encounter it.
Right.
And God forbid if someone were to ever have to encounter, a prostate cancer, when you're at a normal weight, it becomes a doable and treatable thing.
Right.
Yeah.
Right.
Versus oh my gosh, this is going to be a really hard thing.
Yeah.
So, and there's all sorts of cancers that go up for both men and women, like colorectal, kidney, things of that nature.
Yeah.
So, well, what's next for you two? What is something that you were going to do or you have planned on doing that you would have never done before surgery? Anything?
I don't know.
Anything crazy?
No, we don't do crazy.
I don't know. What's next?
I don't know. We've talked about going, and we did some hiking and stuff, doing more of the outdoor.
Yeah, we do like enjoy to do that a little bit more.
So doing that more, like going different places that you wouldn't go hiking.
Mm-mm.
Like we wouldn't have 3 years ago, we would not have made a Colorado or a Grand Canyon or
that's what Luke's really wanting to do.
Thing like that. We wouldn't have made that vacation plan. We'd go to the beach, or we would go, and that's about.
We do still like going to the beach.
Yeah, we'll go to the beach. But we'll add those other ones too.
But
we can go do more activities and walk around and see parts of it, that you don't want to see, or you don't want to put the effort in because you're not going to be able to make it to the top.
Right.
You're going to be scared that you'll make it to
or turn around and have to go back and people see you.
Or have to ask someone from help getting down, or not being able to get through areas. So you're like, those little things that we're looking forward to being able to do next. Like, let's go make a vacation that we would never want to do or never think we could do before. Now we can just do it.
Yeah.
Well, I'll give you something I want to see you guys try at some point. This is one of the best family vacations I have. We did that one episode of like our best one. Well, we recently had our best one. We went to a ranch.
Oh, yes. Yes.
And there wasn't any downtime. We were doing something every morning, every afternoon. And with my wife and 3 daughters, they are always wanting to be on the beach with their Kindles reading books. And I like to do stuff. I don't like sitting for 6 hours.
Yeah.
Ropes course, hiking, horseback riding. There is nonstop fishing, or you're walking in and out through creeks. I would love to see you guys get out there and get some photos of stuff like that.
I forgot you shared that. When you shared that, I was like, Luke, we need to go here. Yeah. Like, not only for that, it just looked so dreamy. Like,
it was a lot of fun to do stuff. I mean, just doing stuff. And, that is something that I can imagine you would not have been able to do beforehand.
We wouldn't even thought about doing it.
I mean, we really got to the point, and it was more so me, I think, because Luke still didn't need a seatbelt extender. Like, because his waist, like, it was his belly, but like down under that belly, like,
put it underneath.
And I just couldn't. And so we got to the point we did not travel anywhere that we couldn't drive. So, and in a short driving, because with 4 kids, in the car. So we just got to the point we just didn't travel.
Well, you're right, though, about how guys can just drop their pants lower and still fit, because our bellies, they don't necessarily hang way down. Right. They stick way out.
Yep.
And you can do that. But that's what I call sometimes, like, whenever I see somebody come in overalls, that is exactly the reason why, is to get it's too skinny down below and their pants fall down and their belly's too big so the overalls are a good way to hold them up. And I always tell them, I was like, listen, in 6 months you're going to be out of those, and they'll
no more overalls.
Oh, thank God.
Right.
But no one notices little things like of why somebody wears overalls like that.
Yeah, I would never have thought about that.
Yeah, little things. So just, I guess, summing it up, obesity in men is really dangerous, causes early death. It has impacts on our self-esteem, our psychological well-being. Luke, I can tell you right now that everyone notices how, I mean, you don't smile very often, but you smile a whole lot more now than
more
before.
Outgoing. Like,
way more outgoing.
Yes.
Like, you put yourself out there where you wouldn't before. So I think anybody that just by looking at you on social media can see not just your physical before and after, but your psychological before and after is completely different. I mean, you just seem a lot more happy. And that, that's something else I see. I deal with a lot of grumpy men when they come in, and we're just kind of, we're kind of mad that we've got ourselves in a situation and we're needing help. And then 6 months down the road, they are the nicest people you'll ever met. You have never associated grumpy with that patient. Yeah. And, we know that now. It's like, listen, we got this. It's going to be fine. You're going to be happy. And I think that's probably one of the biggest transformations that you made is your psychological well-being. Yeah. And then there's all sorts of stuff that we don't like to talk about that impacts our libido and our fertility and erectile dysfunction. And that's why you see all the ads, aimed at us with all the different medicines. So life is good when you get healthy.
It is. Life is good. Yep.
And,
I never knew how good it could be until you are.
Well, and when you realize that obesity is more dangerous and has more negative health consequences than smoking, drinking, and poverty, it kind of puts it into perspective that deal with the obesity.
Yeah.
Deal with the obesity, other things will fall in line for sure.
Yep. So, absolutely.
Congratulations on having the courage to seek help, get help, and then
awesome.
Then just rock it.
Yeah.
Just awesome. And, if we can get him to start wearing the more appropriate university colors in OU, I think you would have made a complete transformation.
Yeah.
So we'll keep it there.
That's right.
Everyone has to have their flaws, right?
Yeah. I do have you wearing some red and white, though. Luke is a big OSU fan, but he's got a lot of Razorback stuff. So we're
Cardinal red.
Yeah. So we're making a little small move. So we appreciate you coming on and joining us. I think, ladies out there, share this with your husbands. It can be done. Yeah. And when you go to our Instagram pages, Laura's and at Roller Weight Loss, you can see a variety of different people and their transformations.
Right.
And, chances are you're going to see somebody that's like, that's me.
Yep.
And our patients help a lot of people.
Before and after. You've said it. They never get old. They just don't. Even when I see other people's before and afters, it inspires me to keep going because it's just unbelievable.
Not worth going back.
No, never.
So as always, you can catch us on Spotify, Apple Podcast Store, or you can watch us in person on YouTube. We'd love for you to download it, share a comment, like. We appreciate you tuning in and listening to us, and we will see you for episode 3 next time.
All right. Bye, guys.
Thanks.